Hi, and welcome to my YouTube channel. A couple of years back, my neighbor he was 65 plus, I think, and he went under a successful angioplasty. And stent was placed in his left anterior descending artery, the LAD, what they call the widowmaker. Everything seemed fine, but 2 years later, just a month before, he found himself back in the ER. What was the reason? He was having a chest pain again, and you know why? Actually, his stent had become blocked. It's a scenario that scares many heart patients, including me, and I ask this question again and again to myself also. What if my stent clog again? And so today we are diving into the detail what really causes a stent to clog and how likely is it to happen, and what you can do to reduce the risk dramatically. A stent is a small mesh-like tube structure placed inside an artery to keep it open after a blockage is cleared. But placing a stent isn't like fixing a leaky pipe and forgetting about it. Your body sees the stent as a foreign object. Even though modern stents are coated with drugs that help prevent new blockages, there's still chances and there is still a risk that scar tissue might be formed or clots can form inside the stent. So doctors call this situation in-stent Restenosis (ISR), a narrowing that happens again and again even after the stent has been placed. So it typically develops within 6 to 12 months after the procedure. So guys, here's the good news, because the chances of a modern drug-eluting stents getting clogged, they are relatively very low, about 5 to 10%, and that is within the first year. And with that latest generation stents, that number is even lower. However, not all stents are created equal. If your stent was placed 10 to 15 years ago, it may have been a bare metal stent, which had a much higher chances of clogging, up to 30% in some cases. So if you are wondering about your personal risk, it's important to know when your stent was placed and what was the type of it. So now let's talk about you and what might increase your risk. On top of that, the number one is smoking. Even a few cigarettes in a day can trigger inflammation in your arteries. Number two, poorly controlled diabetes. High blood sugar levels damages the lining of the blood vessels and it promotes plaque buildup in your arteries. Number three, high LDL cholesterol. The so-called bad cholesterol continues to feed new blockages even after a stent is placed. Number four, skipping your medicine, especially blood thinners like aspirin, Plavix, that is clopidogrel. Missing those medicine, even a few doses early on can be very dangerous. Number five, obesity and sedentary lifestyle. They increase insulin resistance and chronic inflammation, so they are two big contributors to coronary artery disease. So yes, in other words, your stent can clog, but usually when these risk factors are not well managed. Here is something very crucial to note about stents. So many people think a clogged stent will feel exactly like their original heart attack, but that might not be the case. Sometimes the symptoms are more subtle. So you should pay attention to these signs and symptoms. First of all, if you feel any chest pain, pressure, or discomfort during physical activity, especially, and also unexplained shortness of breath, fatigue, or dizziness, or pain radiating to your jaw, back, or arms. So if these symptoms come on suddenly or feel different from before, don't wait, get it checked. So because time is the muscle when it comes to the heart health. The American Heart Association and Cleveland Clinic both emphasize that a lifestyle change is just as important as the procedure itself. So think of the stent as a temporary fix. It clears the road, but if you keep driving recklessly, it will happen again and again. So here is what you can do to help keep your stent open. Number one, this is about medicine. Take your medication, guys, very regularly, especially antiplatelet drugs. Number two, when it comes to diet, so we recommend Mediterranean style diet is better. That is rich in veggies, fish, olive oil, and low in processed food. Number three, exercise. Get 30 minutes of exercise at least 5 days a week. Even brisk walking makes a huge difference. Number 4, regular checkup of your cholesterol. Monitor your blood pressure and blood sugar on a regular basis consistently. On number 5, get regular checkups with your cardiologist. Some people may need a stress test 6 to 12 months after the stents put in. A 2020 study from Stanford University showed that patients who followed these steps had a 76% lower chances of stent related complication over 3 years. So think of your heart like a garden. The stent is the tool that cleared out a choking weed, but now it's your job to water the soil, trim the branches, and keep the environment healthy. So yes, a stent can clog, but most often it's a preventable story. The outcome is not just in your doctor's hands. Actually, it is in your hands. It's a practice every single day you must maintain. So guys, take care of your heart. It's the engine that powers everything else in your body, and protect your stent, and this stent will protect you. So guys, if you like the content, please give it a thumbs up and share it with your loved ones. Also, subscribe to this channel for more health insights and fitness tips. I see you in the next video.